The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. Excited to have a guest here who works with dentists all over the country, based out of the Pacific West, my old stomping grounds. Will Gilmore, say hello to everyone.
Hey, everyone. How's it going? Thanks for having me.
Hey, I'm glad to have you here. Same question we always ask everyone. How'd you get involved with working with dentists? How'd you get in this industry?
So my first venture into the industry is actually kind of an interesting story. I was working for NBC out of Portland, Oregon, and ended up getting loaned out to a small production company that was filming a video on how to properly disinfect a dental operatory. And I said, well, I don't know what any of those words mean, but okay, let's do it. Go shoot the video. And that was my first kind of time walking into a dental office where I wasn't a patient. And I got to know some really amazing people when we filmed it. And I said, man, this is pretty cool. I want to get into this stuff. And seeing the point of the video was they would disinfect the room incorrectly and then they'd reshoot it where they did it the right way to kind of compare. It was just fascinating. And so I talked to the owner of a compliance company at the time who was there filming the video. And 10 years later, here we are starting off and started Elevate last year. But yeah, it's been a wild 10 years and I absolutely love the people that I've met and gotten to work with.
That's awesome. It's always amazing to me the funny ways that people get involved in the industry.
Yeah.
That's a good one. So Elevate Compliance.net is your website. Tell me about Elevate Compliance a little bit. What do you guys do?
Yeah, so Elevate's purpose is to really go on the journey with practices for focusing on compliance. There are tons of compliance companies out there. And for people listening, you've probably all taken OSHA, HIPAA, infection control classes before, and you're fighting to stay awake half the time. And if you do succeed in staying awake, oftentimes the amount of content and information is overwhelming. So what I wanted to do was streamline it, make it a little bit easier, especially in today's day and age of doing things online. So I built a really awesome platform where you can manage your certificates, your forms, your training, your manuals, everything kind of in one place. That's kind of my goal, bring compliance into the 21st century to catch up with all the other great technology that we have in the industry.
So we're going to kind of focus on HIPAA today, right? That's where I'd like to focus in on. And those other areas are obviously incredibly important. I think when it comes to HIPAA, I don't really hear people arguing online in Facebook groups. I don't hear dentists arguing about OSHA compliance. I've never seen, but I hear HIPAA compliance arguments all the time.
Yeah.
I've heard a lot of what I believe are myths, probably some things that are stretching the truth, some things that people don't know what they're talking about, and so on and so forth. So tell me, what are some of the problems? What are some of the common problems that you see dentists? What do they struggle with the most?
Best example that I can think of, online discussions like you're talking about, because it is a hot topic to argue about various HIPAA rules and regulations online. And first of all, I'll just say for anybody listening, please don't go to Facebook for your best advice on HIPAA. Listen to a professional who knows what they're talking about.
Yeah.
But one very common thing that we do see people arguing about is online reviews, and especially the dreaded 1-star review, right? Especially when that 1-star review involves maybe not the most accurate information on the part of the patient who's complaining. And so that's definitely something that we see a lot of people arguing about online, or not necessarily arguing, but debating about what's the best way to respond or deal with those really difficult reviews.
So what is it? Let's talk about this. What are some of the things that you for sure cannot do?
That's a good starting point. Yeah. So first of all, one thing that you can for sure not do is reveal any patient's information on a public forum without their permission. And let's be honest, when it comes to a review, they're probably not going to give you that permission, right? Even if you were to ask them first. But most of the time, we don't even ask, because when it comes to a review, we're trying to defend our practice, right? We're trying to, especially like I said, if the review involves maybe not the most accurate account of what took place, you want to defend your office. You want to be able to stand up and say, hey, that's not really true. But even acknowledging that a patient is in fact a patient in your practice could be considered a HIPAA violation. So we have to be extremely careful about how we respond. And so if you'll allow me, I'll just kind of go in and talk a little bit about kind of the two camps of thought that exist under the thought process behind responding to reviews. There's kind of two approaches that people take. One is that you just don't respond to negative reviews. I'm sure you know who Alan Stern is. I asked him, because he does a whole consulting service, and part of what he does is talks about the dreaded 1-star review. And he says, bury it under the good reviews. Don't even respond to it. Just bury it amongst your hundreds of 5-star reviews. And that's good advice. The other camp of thought, though, is that you should always reply to reviews, even if they are really negative, because you want to appear responsive but not defensive. And so if you're going to be in that second camp of thought there, you have to be intentional about the language that you use, because again, you don't want to accidentally reveal something on a public forum like a Yelp or a Google platform. There was an office during the pandemic in Texas that was actually cited $10,000 for one single review because they responded and left a bunch of patients' information on the review, gave the patient all the ammunition that they needed to file a complaint. So those are kind of the two, initial schools of thought regarding responding to reviews.
As a marketer, I'm in the school of thought that you should respond to all reviews, no matter what, good, bad, ugly, indifferent. So PHI, acknowledging that a patient came into your practice does not acknowledge they were a patient.
It's not quite that black and white, right? Because here's the thing. Let's say you're the doctor and I'm the patient and I leave the negative review and I came in and you said this and you did this and blah, blah, blah.
Yeah.
Well, I have already acknowledged that I'm a patient in your office, right? I've already put that out there. But by responding to, actually, that's not how the conversation went, or responding specifically to the things that I've said, that's where we run the risk of potentially revealing PHI. So it's not quite as simple of an answer of yes or no. It depends on what the initial review said. It depends on the language that you use in response. So it's really hard without looking at some specific examples to be able to give you just a simple yes or no answer. And really, that's true for most things under HIPAA. There's a lot under HIPAA that operates in that gray area.
So let's talk about HIPAA in general. So outside of reviews, if I recall, the language that is actually in HIPAA as far as guarding patient healthcare, private information, is reasonable measures. Is that the terminology that they use, that the provider must take reasonable measures?
Yeah, so the word reasonable does show up a lot in the law. And again, that's kind of where that gray area comes from. Yeah.
Right. So what is reasonable, right? So, because you could say, hey, having the patient information inside of a file cabinet that has a lock on it instead of a room is reasonable.
Mm-hmm.
Someone else could argue it'd be ridiculous. Like, you gotta have like a laser detection system. You gotta have a couple of samurais, a couple of
bars on the windows, right? and armed guards outside.
It's reasonable. So that is what it says. So that's kind of what we're talking about here, right? What is reasonable and what is not reasonable. So let's role play some actual reviews.
Sure.
So I come to your office or I don't come to the office. That's always a fun review to get, right? The one that the patient didn't come in on Saturday. He hadn't been open for Saturdays in 25 years.
Right.
I went in and visited Dr. Will. Dr. Will said that wasn't hurt. It really, really hurt a lot. It's just getting a crown. There's no reason why it should hurt this much. I would never go to this doctor again. So I bet you that review actually exists out there somewhere.
Probably somewhere.
Maybe not Dr. Will. But how about a response that's somewhere along the line? Thank you very much for taking the time to leave a review. We appreciate all feedback. It is our policy here to talk to patients about every single step of any procedure that they're going to happen so that they're aware of everything. We invite you to contact the office if you would like more information, or we can help you in a different way. Is that violating HIPAA?
Nope. Beautiful answer.
It's just vague, right?
Everything that you stated was about policy or about how we manage ourselves and our interactions with patients. It wasn't what you said was wrong or you came in on this day and actually said this. It was our policy is we approach every patient from this standpoint. And I love that you ended it with, we invite you to reach out to the practice to discuss your concerns. That's always a great way to end it because it doesn't shut them down, but it does invite them to discuss off of that public platform. So again, you thinking about what the purpose of responding to an online review is, right? It's almost less for the person who left the review. Well, I guess for negative, it's for a negative review, your response is almost less about for that response to that person as it is what other people are going to see how you responded to it, right? So the response that you just said is a beautiful answer because anyone reading that review is going to see that when that person flew off the rails and left that message and your response was responsive but not defensive, and you invited them to continue the discussion, you want to try to make it right, that goes a long way towards protecting your reputation. And so that's really almost the more important piece than it is necessarily the individual's reaction or responding to them.
Yeah. We have on our website, and I'll give it to anybody who wants, we have templates for responding to reviews.
Awesome.
Good, bad, or ugly, and that you can use and, rehash. But we always make it very, never mentions the patient's name. Right. Because you can be vague. Don't ever admit that they ever had a procedure there, a treatment there, or that they were ever in there. Just thank them very much.
You got
Thank them for sharing their experience. That's how we look at it. No.
I love it.
All right, perfect. I'm glad I've been given good advice on that. We've kind of gone through some legal channels on this. Of course, I'm not a lawyer. I'm not experts in legal. So I'm glad that you're here kind of helping us with this. And I believe that you should respond to every review because it is one you will come up higher in search if you're responding to multiple reviews. It creates a feedback loop. The more reviews that you get and respond
Yep.
to, the more times Google will send people to your site, meaning you have more people to get reviews. And like I said, good, bad, or ugly, I think you should respond to all of them. The patient wasn't a patient there. I actually say that, hey, we don't have a patient on record by this name.
Yeah, so I
Right.
have an interesting little just
Yeah.
quick story about that. So I was doing a HIPAA lecture once in an office, and I don't remember the name of the practice, and I probably shouldn't say it even if I did know it, but let's just say it was Dr. Johnson DDS, something like that, whatever the name of the office was. And they'd had a negative review for a Dr. Johnson DDS in like the other side of the country. So they were in Washington, and the review was for an office in like Virginia or something like that. And it was a pretty negative, nasty review, and it was for the wrong office. Well, because they are not a patient, there is absolutely no HIPAA violation by pointing that out because
Sure.
they're not in your practice. So
Right.
just to your point, hey, I think you might have us confused with a different office. We do not have you as a patient on record, and stating that is not a HIPAA violation because it's the truth. And so, yeah, just to your point, I always love to share that example. If you ever have someone who leaves a review who's not a patient, you can absolutely point that out.
Right. Now, I will say that, and this has nothing to do with HIPAA, but it does have everything to do with how you present yourself. If every single day, if you have 20 negative reviews and none of those people were a patient in your office, it's going to look pretty funny to people, right?
Yeah.
So I believe that people are understanding. I like to, every couple of months go out to a schwanky steakhouse. It's expensive. Once in a while, you spend a ridiculous amount of money and they overcook or undercook your steak. Do I flip out? Do I leave a bad review? No, but I want them to handle the situation correctly. And as long as I know that they're going to, everything is great. And I think that's what people want when they see a bad review. That's what I personally believe they want when, hey, this was an experience for the patient. Sometimes it's going to happen. Let's face it.
It's inevitable. Yeah.
You're 100% right. But people just want to make sure that you care and that you're going out of your way to make things right. I think always inviting that patient to come back in is good. I will tell you some things, and this is outside of HIPAA, which you should never do. One-on-one conversation with the patient, never threaten them. Never tell them if they don't take down the review, you're going to sue them because you're going to end up with another review that's going to say that. That is absolutely going to positively going to say, hey, they threatened me after I left this review. And that one's going to.
An important note on that thought is who is allowed to leave information about the patient? The patient.
Right.
So like you said, anything that you say is going to find its way back there because you as the practitioner, you can't talk about it, but the patient can. And that's the scary thing. So absolutely, you're right. Never do that. Yeah.
And something else that I see this often, and you mentioned don't get advice from Facebook groups. I will see a doctor cut and paste a review from Google or Facebook, and they'll copy that page, they'll put that review into a Facebook group, and then they'll tell their story. This patient actually had this, and this. I only told them about this. This only happened here. I didn't charge them for this. They're giving so much more PHI than the patient ever even thought about doing. And the patient's name's right there. And even if the patient's name's not there, but the doctor's name is there, you can go Google it, find the review yourself, and now you have the patient's name.
Yeah.
You can connect those dots. What if you accidentally say, hey, well, sorry about the issue with your crown. Then it dawns on you, or a team member does it, trying to do the right thing, and they make a mistake, and you do make that mistake, and you do put PHI out there.
My thinking is you should always immediately think about mitigating the damage, which means remove it as quickly as you can. Directly communicate to the patient that you apologize for the mistake of posting it. Inform them that it has been removed and do your best to apologize to them for that. And then again, if it was a team member, it's time that we have a discussion. Maybe the entire team needs to come together and we need to have a quick recap with the team. Hey, you know what? We can't do stuff like that. You can't be using patients' names or talking about their treatment, and document that you had a discussion with the team. Because all of what I'm thinking of is what happens on the other side. So if the patient reads that review and they get upset, a patient actually cannot sue a practitioner under HIPAA. That's a common misconception. People think that a patient can say, I'm going to sue you for my HIPAA violation. It's actually not really something they can do, but they can file a complaint. That office in Texas I mentioned earlier that had the $10,000 citation, that was because the patient actually complained to Health and Human Services. They saw the review and they imposed the penalty on the practice. So if you're thinking about that as the potential outcome, a potential HIPAA violation or complaint from the patient, apologizing to the patient and documenting that apology, removal of the incorrect post, and then a documentation of a team training where you discuss that it cannot happen again are all going to be things that go a long way if a HIPAA investigator shows up and says, hey, we received this complaint. What have you done about it? Well, we've already removed it. We've already reached out to the patient, and we've already done a team training to make sure that it doesn't happen again. Those are all going to be the best ways to really prevent there from being a negative outcome. Will it completely absolve you of responsibility? No, there may still be a violation. There may still be a penalty, but they really won't just want to see that you're taking the steps. HIPAA is actually a really good organization. People think that federal government agencies are just out to get them. HIPAA is
Sure.
not that way. They would much rather see a practice be compliant than slap them with a penalty. So
Right.
if you can demonstrate that you've taken some steps to mitigate it, that's going to go a long way.
A patient can't, just to clarify one thing, this is a question on a statement. A patient can't sue for a HIPAA violation, but a patient can sue you if they have damages that happen from you putting out their private information, correct?
That's correct. And usually a review is not really going to cause damages, especially
Right.
if, again, you immediately remove it, apologize, do the team, there's pretty, unless you did say something like you owed us X amount of dollars and you never paid or something like that. But as long as you're not getting way too deep into details, usually accidentally leaving a name or mentioning a date of the appointment, things like that can't really cause damages. But that's, again, usually a general term, right? It's certainly, I suppose it could. And so that's why it's always best to avoid it, at any cost.
It's elevatecompliance.net.
Yep.
I personally think getting help with this is usually better to do before you get into trouble. Will, what's it like if somebody calls you for more information? Kind of what's that process look like?
Yeah. So the first thing that we always do is schedule a demo call where I can show them the platform. No obligation at all. It's just an opportunity for me to kind of show them what's different about us, talk a little bit about what their needs are in the practice. The reality is we're not the best fit for everybody. And so we want to kind of find out what the practice's compliance goals are, what they're looking for. If they're looking for the bottom of the barrel cheapest option, that's not going to be us. We want to be with practices that really want to be compliant. And to your point earlier, if you do preemptive work and avoid citations, it is way cheaper and way easier on your practice than if you wait till after it happens. So
Yeah, makes
there
sense
you
to
go.
me. Will Gilmore, elevatecompliance.net. Check it out, folks. Will, thanks again, man. We really appreciate you coming on.
Thanks, Patrick. I appreciate your time. Thanks, everybody, for listening.